Hi, I'm Jennifer. I'm a certified diabetes educator that will be talking with you today about diabetes education and the relationship between heart disease. People with diabetes are at significantly higher risk for heart disease, and understanding the connection, risk factors, and preventative measures is important. Let's talk about some common questions and answers about diabetes and heart disease. How do you know if you have diabetes? Schedule an appointment with your provider to discuss your concerns. Everyone over age 40 should be screened for type 2 diabetes. If you have a family member with diabetes, you can talk to your provider about being screened earlier than age 40. Lab work can be done to check fasting glucose levels and A1C. Fasting glucose is checking how much sugar is in your blood when you have not had anything to eat or drink for the last 8 to 10 hours. A1C level is the average blood sugar for the past 3 months. I can show you a couple visual aids that will help you understand these concepts. Ask your cardiac rehab nurse for a copy of these visual aids when this presentation is over. How do you know you would be diagnosed with diabetes? This just helps explain what your fasting blood sugar should be, if you were in a pre-diabetes blood sugar range, and when you would be diagnosed with diabetes according to your fasting blood sugar and your A1C level. The next handout also just shows blood sugar goals at different times of the day, and then what your A1C percentage is, and the coordinating average blood sugar level. Another question is, how do I feel if I have diabetes? You may not feel any different when you have diabetes. That's why it's important to have lab work done yearly and have levels checked. Over time, if your blood sugars are high, your body will send you signals like increased thirst, urinating more frequently, especially at night, becoming very sleepy, blurry vision, and infections that are slow to heal. There is also a handout that explains high blood sugars. Again, your cardiac rehab staff will hand these out to you after this presentation. You may also have symptoms of low blood sugar. That would make you feel shaky, sweaty, dizzy, weak, tired, and confused. If you are experiencing symptoms of high or low blood sugar, contact your provider right away and ask for a referral to the diabetes center. What is the link between diabetes and heart disease? When your blood sugar is elevated, it causes damage to blood vessels and nerves in your body. The higher the sugar level in your blood, the slower and thicker your blood moves through your body. With heart disease, your blood vessels are hardened and may have plaque buildup. The combination of thick, slow blood through damaged blood vessels increases your risk of stroke and heart attack. I do have another visual aid that just shows what regular amount of sugar would look like through your bloodstream. And you can see that there should be some sugar in your blood. It's the little white bubbles that float through there. And then the red piece is your red blood cells. When you have too much sugar, which is shown in this, you can see all the sugar clumped up around that red blood cell, and that causes your blood to be very slow and sticky, and you can see how you can be at higher risk to have a clot form when all that sugar is stuck in your bloodstream. This would increase your risk of having a stroke or a heart attack. How can you protect your heart and your heart health? First of all, manage your blood sugar. Know what your blood sugar levels are running, and this can be checked through a lab, or ask your provider about lab work to check your blood sugar. The goal for people who have diabetes is to keep your blood sugar between 70 and 180, 75% of the time. If you have diabetes and your blood sugar is running above 180 or below 70, ask your provider for a referral to the Diabetes Education Center. Blood pressure goal is next. Blood pressure should be kept between 130 and 80 or below. Maintain a healthy blood pressure level through medication and lifestyle changes. Have your blood pressure checked at every visit with your provider, and you can check your blood pressure at home with a blood pressure kit. Talk to your cardiac rehab staff if you have questions about getting an at-home blood pressure kit. Also, keep your cholesterol in check. Follow a heart-healthy diet, and you may need to take cholesterol-lowering medication. The 2025 American Diabetes Association guidelines recommend specific lipid targets for people with diabetes. The goal for your LDL cholesterol to prevent cardiovascular disease is less than 70 for adults age 40 to 75. If you have established cardiovascular disease, the target is to keep your LDL less than 55, along with quitting smoking. If you smoke and you can quit, this will reduce your risk of heart disease. Maintain a healthy weight. Achieve and maintain a healthy weight through diet and exercise. Be physically active, engage in regular physical activity, such as a brisk walk or jogging, along with strength training and stretching. The goal is to work up to 150 minutes of activity per week. This can be approximately 20 minutes daily or 30 minutes 4 to 5 times a week. Be sure to check with your provider on what activity is safe for you. Regular checkups. Have a regular checkup with your doctor to monitor your heart health and diabetes management. Ask about a referral to the Diabetes Education. We are all part of the same team, and we are here to help you live your best life.